Welcome to Innersight, Health Optimization with Rudy and Shaun.
Right here, Shaun, here we are, podcast number 16. In our previous podcast, we delved into women's health quite a bit, and we thought we would swing it back to the men. Testosterone, something we all have, men and women. Men obviously have a bit more, and we've been seeing quite a bit of change in how the thinking is. We've seen a lot of people on testosterone, maybe shouldn't have been, people that we now see that should be, and that made us delve quite deeply into how testosterone works, when to prescribe it, and it's been an interesting path for us learning about testosterone again after med school.
Yes, we don't have a guest speaker here today, so it's a chat between the two of us. We had to delve into the literature on testosterone. I think we learned a lot, and we actually see quite a lot of it in the practice at the moment. And I think today's talk or discussion would be around what we do and how we approach the subject in our practice. It might differ in other practices, but this is the way that we do it. Yes.
Yeah, and I think that's the reason why we should talk about this, just us two, because, testosterone influences the urology cycle, the endocrine cycle. So, it affects everything in the body, but the people that mostly prescribe testosterone in South Africa are the urologists, and we differ a little bit about how we think about it. So the physiology stays the same, and maybe we should kick off just broadly for our audience, just say how testosterone gets made. Men and women, it's quite an intricate process. So we need to know just where it gets made and all that.
Yeah, so I think we'll keep it very basic. But basically, if your testes make the testosterone in the Leydig cells from cholesterol. So that's the first building block that you have is the cholesterol, and it's made from the cholesterol. And then you've got the local production, but you've got a central control in the system. So if the local production goes up, then you'll suppress it at the central level.
Yeah, and that's how I normally discuss it with the clients that come to us as well. Little gland inside your brain that tells the testes, or in the women, the ovaries, to make the testosterone. And then once it's made, it reads, okay, is it enough? If it's not enough, it ups the LH, or the luteinizing hormone. And if it is enough, it keeps it at that level. So it's a negative feedback loop, pretty easy to understand, very much like thyroid stimulating hormone with the thyroid. Then testosterone is made there from young. It goes up into puberty. It gets a really big spike, especially in the boys, and then early adulthood, and then at around 30 we turn around and say, okay, but
yes, yeah. So it does reaches its max around about 18 to 20, keeps it there for a while, and then 30 it starts to decline over time. And that's a normal cycle. So you lose a little bit over time, up to 50, usually around about 50. And we're talking now about just the normal things that can happen with testosterone and healthy aging. We talk about people that had normal testosterone before, so they had a normal levels in their life, and now suddenly, slowly, it starts to decline and you start to get symptoms. So in that group, around about 50 is often the time where people complain about symptoms related to low testosterone. It can happen earlier. And I think, the approach for the young person and the older person is absolutely completely different. And one needs to ask a lot of questions around what you do in this sphere.
Okay, because maybe before we go to what's bad, let's talk about what's good about testosterone. So
why do we need testosterone?
Yeah.
I think that's the first step, is what does it do in the body? So obviously in puberty, that plays a big role in the development of the male. in muscle mass, in genitals, and hair growth patterns, and things like that.
Drive and mood. I think that's. I think people need to understand if you're a man, what you felt at 21, you can break the world. You can fall off a bridge and pretty much still regenerate. So you've got strong bones. You can run fast and far. So you've got good red blood cells. You've got good muscles. You've got strong muscles. So all that is part of, obviously you've got a bigger sex drive than you have at 45. All that is testosterone. I mean, testosterone's not just testosterone, but it's interaction on the different parts of the body. Very little brain fog, good sleep, all that type of things is what testosterone does in the body, and then the decline is obviously the opposite.
The opposite of that. And so it's the vitality hormone, basically. And hence, when we get older, we lose that. We lose the edge, if you can put it that way. And mostly it's not the sexual things that people complain about in the practice with us. It is the brain fog, or the loss of drive, or just a lack of energy later in the day, things like that they complain about, which might point to a low testosterone, but it can be many other things as well. And I think that's very important to understand. You need to see the person as a whole to make decisions on their health.
Yeah. And while we're talking about these levels, before we say how we think about it, it is, we're not going to speak about exact levels today, but I mean, when we studied medicine about 30 years ago, it is now known that our grandfather's testosterone levels were almost double as high as ours, just for the main reason they were not sitting behind desks. They picked up heavy things or caught the sheep, or were carrying calves around. They did physical work, and that is what we're lacking today. Is we've got sedentary workspaces. We don't sleep well. Type 2 diabetes, so obesity, because in that obese body, the testosterone, like in the obese female with her estrogen, it gets deposited there, and it's not free. So our levels that we test for now is a lot less the reference values than our grandparents.
Yeah, that's what I mean. It's 15 to 20% lower. Now you need to remember the normal level is 15 to 20% lower than 20 years back.
And it's actually scary. And in my mind, then, if that trend continues, hormone replacement therapy or testosterone replacement therapy is not a if, it's a when. Because you are going to fall by the age of 80 years old, 90% of males are below a treatment level these days. So.
Yes, and I think we're also more conscious about healthy aging. We do want to feel good when we age, and we're living longer. So you get to a point where you might just need some help because the levels are so low. And because the normal levels are 20% odd lower than 20 years back, when you get tested, your levels might be seen as normal, which compared to then is not normal. So it's something to think about.
Yeah. Okay. And I mean, we see a lot of people with a little bit of brain fog, and it's not as easy as picking up the script pad and writing a script. It's not an antibiotic. It's a choice that could be for life, like for a statin or for hypertension medication. A choice to be on testosterone replacement therapy could be a choice for life. So we need to exclude other things that can be fixed without medication, and I think that's a big thing we have to get through today.
So we're very fortunate that we see the person as a whole. We've got a lot of blood work in front of us. We've got exercise testing data in front of us. We've got questionnaires that they've completed in front of us. So it's definitely not a blood level. We don't look at the blood level and say, oh, you need testosterone, there's your script, there you go. Never, ever you do that. So we've got a lot of information. And if you just think of the symptoms of low testosterone, something like sleep apnea can look exactly the same. So, we need to exclude certain things like sleep apnea. That's not the cause of the low testosterone. Because remember, when you get a little bit older, it's usually your LH that lowers, and you don't stimulate the Leydig cells to produce testosterone. And there's a lot of things, like I'm in a stressful lifestyle, too much alcohol, not enough sleep, things like that, endocrine disruptors, that can affect the LH secretion. And therefore, the testis doesn't get stimulated to produce the testosterone that you need. So you need to exclude those first before you can think of any replacement therapy.
I think before anyone considers testosterone replacement therapy, they should go to someone that tests that, because we've talked about the pros. Okay, so the pros being very nice, that it makes you feel more lively. There could be an increase in muscle mass. There could be a decrease in your body fat. I mean, there's quite a few things that can be nice, but the bad part, there is cons to taking testosterone too early. And I mean, we've all heard the value or the young 28 or 30-year-olds that have been put on testosterone. So if we think about the bad things, I mean, the first thing that springs to mind is you can actually make someone sterile.
Absolutely, and hence also the age at which the patient presents to you. So if it's a 45, 50, say 50 plus year patient coming to you and they're done with the family, they don't want more kids, then it makes it easier. You can have the discussion if they excluded certain things, but the decision to treat is easier. I think it's in the younger age group where you really need to think what you're doing. Okay, and you don't want to start on treatment without doing all the other things right first. And then the treatment options will also differ from what you will do in a 50 plus person.
And I think just to reiterate what the things are that you want to do to make sure your testosterone is at a good level. Number one is sleep. And we've been saying it since our first podcast, is that sleep is your superpower. You need to get enough sleep. And I think the next thing is pick up heavy things. You need to do some form of heavy lifting. So if it's not weightlifting, high intensity interval training, so you need to do quick, fast, heavy stuff. The zone 2 training here won't do the trick really for testosterone production. You need to tell the body, I need it. I need to be bigger. So
yes, absolutely, and also exclude certain things in lifestyle. I mean, just like don't drink too much. I think in South Africa, we've got a drinking culture almost, and some people might think like half a bottle of wine a night is normal or it's okay, which it isn't. I mean, the newest data coming out shows that no amount of alcohol is good. So,
yeah.
And that definitely suppresses the LH and testosterone secondary to that.
And the other side is, it interferes with your sleep so much. I don't think people realize how bad they sleep if they've even had one glass of wine.
Sleep is an interesting thing because it goes both ways. It's like a lack of sleep can reduce the testosterone, but also low testosterone can have havoc on your sleeping pattern. So, and that's the same with sleep apnea as well. It can be the cause, or it can worsen it. So you need to really look at the person in a whole and need to screen through everything and then have the discussion on treatment or not.
Okay, so let's say we've got someone we looked through and we've excluded most of the sleep apnea. So like sleep apnea, we send our clients to a sleep lab and they get tested. So you excluded that. You made sure that we obviously test their strength training or their strength in our assessment. And then what is the options? Where do we start with? Let's say bang for the buck, 47 to 52-year-old guy wanting testosterone therapy. What's our options? Do we do?
Yeah, so once they've dialed in the lifestyle stuff, then we can look into treatment options. And the first question then is 47 to 52, are you done with children or not?
Yeah.
Okay. And let's assume that they're done with children. They don't want any children. The family's done, and they really their complaints are more they just need their drive back, or maybe they struggle to put on muscle mass, which we really focus on to get that muscle mass up for older age and to try and prevent falls and things like that. Then the standard treatment out there is usually the type of depot testosterone that they get from the urologist or wherever, their GPs or whatever.
So for the clients out there listening, so that is the people that go for their 3-monthly injection, Nubilo or whatever. So we have seen that quite a bit.
Yep. Oh, well, that's the standard of care in South Africa at the moment. But if you look at the normal cycle, you'll see that testosterone is the highest in the morning, around about between like 6 and 8. You get a peak in the levels. Then it comes down slowly around about noon, and afternoon it's on its lowest level. And then at nighttime it starts to slowly go up again to peak in the morning. And that's the normal cycle. Now, if you go onto a depot type of product, then you've got the chance of overshooting on the one side and then undershooting on the other side, meaning that you give the depot dose, it takes a time to reach a certain level, but then it overshoots. You have too much of the medicine in your body. And then there's a period of time that you will be in the zone, let's call it in the zone, where you're in that level that you want to be in. And then it's going to fall below that level again for a while. So on both sides, you won't feel well. So you only feel well in that middle part. And the unfortunate thing is with the overshooting, that's where you get the side effects as well. That's where it's more likely that you switch off the axis, where it's more likely that your hematocrit is going to go up and things like that. So to do a monthly or 3-monthly type of depot product is not ideal. And that's where we looked into what is the guys overseas doing, and looked into some of the clinics, what they do. And obviously we're going to try and mimic a type of pattern that's more natural as such.
Yeah, so I think that's quite important. So we've looked at that, and we want the pros of testosterone replacement therapy, but we don't want the negatives. And I mean, number one, it's quite sore to have an injection every 3 months. You can have an infection. You're piercing the skin. And for us, even taking all of that out of the equation, we don't think it's the right way to go with having these spikes and then a slowdown. And I mean, even if you change that by 2 weeks on either side, then you might be very low, or you might still be too high and then have a proper overshoot. I just wanted to clarify the axis, just that our listeners understand again. The axis is what we talked about earlier, that this axis between little gland inside the brain telling the testes, if you get too much stimulation, you will pretty much switch off the production inside your brain or in your head.
Yes. So you'll switch off the LH production, so you won't get any stimulation to make your own testosterone. And that can be a long-lasting effect. And it's important to know that.
And you will then need to be on replacement therapy forever.
Yes.
Okay, so we've got the depot, and then we can also inject either in the muscle or under the skin as a weekly injection.
Yeah, so to try and overcome that whole overshoot, undershoot type of scenario, the ideal way would be to do a daily injection. But obviously, with the daily injection, you'll use the same dose, but you'll give it in smaller amounts in a daily dose, say subcutaneously. But It's not nice injecting yourself every day. Yes, it doesn't sting that much, the injections, especially if you're on the low dose. If the dose goes up slightly higher and you do less often injections, it's a higher dose and it might sting more. But you mimic the natural pattern if you do a daily injection. It's just not practical. It's difficult for anyone to adhere to something that they need to inject themselves every day. Hence why the 3-month injection is so popular, because it's a one injection and then they don't think about it again. But there's better ways to get the levels at a more constant, natural way. So one of the things that we can do is we can use something like a cyprinate, and which we can then either give a bi-weekly or 3 times a week injection subcutaneously with lower doses, but the total dose will be the same as what you would have given in another way. So, and then you get a pretty much a almost natural type of pattern in your levels.
Yeah, and again, 3 times a week injection, and I don't know if anyone has seen what a testosterone injection looks like, but it's quite a fatty compound. Trying to pull it up into a needle and a syringe, and then trying to give it to yourself.
Yes, but that's the problem. I mean, it's a very viscous type of medicine, and to give that injection is not easy. Hence why we moved to the creams or the gels.
Yeah. I wanted to say then the other option these days are a gel, a patch, or a cream.
Yeah, and they can do pellets as well, but yet again with the pellets it's also it's very similar to a depot type of method.
Yeah, and you have to go under the skin. So and then coming back to why we're thinking that's the best option is you don't break the skin, you can give it every day. Very easy to travel with, doesn't need to be in a fridge or anywhere that light can be an issue. So it's actually very easy. It's like taking your toothpaste with you. So that's the pro, that it can be made for you. It's bioidentical, done by either a lab or a compounding pharmacy. But obviously with everything there's pros and cons. So one of the cons is it can be variable, the absorption. So you need testing to see where you need to be.
Yes, and obviously transfer. So people are concerned about transfer. So if you rub the cream onto your skin and then you hug your kids or your wife or what, then it might transfer the testosterone to their bodies. Yeah. So you just need to be aware of that. And things like you don't want to have a shower just after you've applied the gel. So just timing-wise, you just need to think about how you're going to do it. But from the way the cream works, it's nice that within about 2 to 3 hours you get your peak level. And then we advise men to rub it in the morning so that you mimic the morning peak that you get in a natural way. And then it will also decline over, depending, 8 to 16 hours, depending on your absorption and your specific body. Meaning that through the night you will actually have quite lower levels, and then the next morning you can apply the cream there. So you get that cycle, which is very similar to a natural cycle. You're less likely to switch off the axis. You're less likely to overshoot, and hence less likely to get increase in hematocrit and things like that. So it's a nice way of giving it, but it's a little bit of playing around at the beginning to find the right strength of cream that we can use. And that's why we use a compounding pharmacy, so that we can make the cream exactly the right strength that you'll need.
And then the other side is that that you're getting it bioidentical made, and you apply it the certain way. I mean, not everyone wants to apply it to their forearm or to their arm. It's mostly applied to thin skin, but everyone wants to apply it somewhere different. So people should not apply it to areas where there's big fat layers, so normally not on the tummy or the back. So, but
Yeah, and partly also because then a part of that testosterone will be converted to estrogen, so then you can get the man boobs from that, and you don't want that. So
yeah, that's and that's, I mean, the bodybuilders out there will probably know their cycles that they had to do, because none of this was really known then. But I mean, obviously the guys that misused testosterone early was the bodybuilders, and they talked about the man boobs that people got, and how you prevented that, because they needed to give the blocking agents. And
yeah, so the idea is, I mean, if you just want to replace to your normal levels, then you shouldn't get into that area. So we're not keen on giving any estrogen blockers. It's unlikely that we're going to overshoot that way. Yet we test, so you'll know if your estrogen going up. If you have symptoms, we'll test and see what's going on. But that's mainly from the high dosages that they've used in bodybuilding.
And it does happen these days. I think it might be a good time to talk how we got onto this. Is that one of our clients was using testosterone, but he wasn't even aware how much was given, or it was just someone in the gym giving it to them. I mean, that is the wrong way, and that is exactly why we're sitting here to say there's a very specific way you will get to, or you need to get to the right level, and make sure it is a good thing for your body, because it can so easily be a bad thing for your body. And
it's one of those things that
testosterone level of 4,000 is not good for you.
No, so it's one of those things that you need to test the levels. It's not a script that you give and there they go and they take it. You need to test the levels to make sure where they are on the scale, and and dial down or dial up as needed to get to that level. I mean, there's oral testosterone also available, but that goes through the liver and it can be liver toxic. So we stay away completely from that. We had actually a client that had some supplements with some testosterone in it, which they didn't know they were taking, but we picked it up in the blood levels. Just be careful sometimes what you take. Just make sure you know what you get from some person out there.
Yeah, and I think the one thing we also need to touch on is maybe clomiphene citrate, or Clomid, is also given to younger men that want to stay fertile. So that is.
So I think up to now we've basically discussed the 47 plus type of client or patient. But the younger guys, definitely, you've got that two options of the clomiphene or the HCG that you can use to try and, it's basically mimic the LH to see if you can stimulate the testes to produce
the body's own testosterone.
Yeah. And that's also in that age group where they might still want kids.
Absolutely, yeah. And I think, I mean, again, clomiphene or HCG, they again, not without any side effects. They come with their own profile. So I think just make sure that you know that if someone is going to tinker with your hormones, that they know what they're doing, because you want to stay in the physiological levels if you're young, if you're old, but don't let someone give you testosterone when you're 28 and not know what it's going to happen, or what it's going to do to you and what's going to happen. I mean, yes, we all want to feel better and look better and all that, but if you still want to have kids, be very, very careful.
Absolutely. And I mean, if you're 28 and it's low, then you need to ask the question why. So yet again, it's not just a blood test. You need to have a proper examination, proper tests done to know exactly where you stand. We don't like the clomiphene that much, especially in a young male. If you're going to take it for a long period of time, it will have a negative effect on your lipid profile. And so we're going to try and stay away from that. We'll probably advise to go on the HCG for a young male, and then we'll work closely with the specialist when we go that route. When we're in the 47 plus type of age group, we feel comfortable to do that ourselves. Just something to keep in mind. Some people just remember also that if you go on the replacement, your testes will shrink a little bit, about 20%, 25%. So for some people, that's a big issue. So you can use the HCG together with the replacement to keep testicular volume and to try and keep that axis going. And that you'll discuss with the patient when you start the treatment, if it's needed or not.
And then I think we need to touch on when we trained and thought about testosterone and the therapy, the prostate. I mean, the new research on the prostate is pretty much excluded that it will have any major side effects on the prostate, like prostate cancers and all that type of thing.
Yeah, so I'm starting to think that, everything we learned at med school is nonsense. Everything has changed, and the new data clearly shows that it's fine to supplement when you're low to a normal level, not a super level, but just a normal level. You might increase BPH symptoms slightly with replacement, and sometimes that's just for a short while. But
just to bring our layman listeners in, so BPH, benign prostatic hypertrophy, meaning the swelling of your prostate. So swelling of a prostate happens as we get older, and then you can have BPH symptoms, which includes you can have a bit of dribbling, you can have a little bit of a slower stream when you urinate. So that's pretty much what we're talking about. So
yes, but the whole cancer fear, it seems to be not that much of an issue, and most people are feeling fine to supplement to normal levels these days. I mean, there's even studies showing that if you've got a low testosterone, your risk for prostate cancer is higher. So there's quite a bit published about it, and we feel safe to do that. And the other thing is also the cardiovascular risk. I mean, that initial papers came out, and it's like there's a big increase of possible cardiac events in the first 2 years after starting replacement therapy. But I think that's also been debunked type of thing. These days, like, unless you had a major cardiac event, we'll maybe wait 3 to 6 months before we initiate treatment. But the cardiovascular benefits that you do get from replacement outweighs it.
And I think the other thing that you have to think about the risk before that is it is going to lift your head a little bit. You are going to be feeling a drive to do more. And the moment you start doing things, you will build more. So it's like a positive snowball instead of after an event that you have a negative snowball that you do less and less and less. So, and I think the message should come through. It is more acceptable these days, but you have to be cautious. And that andropause, the earlier you test, the quicker or the more data we'll have for when that happens.
Yeah, but I think also it's important to understand that if you take the testosterone, you need to change lifestyle. You need to exercise. You need to do all the things right. It's not going to do anything if you just sit and take the testosterone. It doesn't work like that. So there's a commitment needed from the patient as well, and that's part of the discussion we have. So listen, this is your blood work. This is your symptoms. This is what you look like on paper, and we can start the treatment. But you need to do X, Y, and Z. And X, Y, and Z will be, you need to do the exercise. You need to do the resistance training. It doesn't help you take the med. You're not going to increase your muscle mass if you don't do the resistance training. So it's a crutch. It's going to help you, but it's not a miracle type of cure for something. I think a lot of the clinics on the internet that you see popping up everywhere, it's just advocated as this miracle cure for everything, and that's not true. First of all, you need to see the patient as a whole, make sure why they do have the low levels, and then work with them to get the levels right and get them to work with you as well.
Yeah, and I want to come back to that again. Is no one wants to have you as a bodybuilder or anything. It's just bringing you to physiologically normal levels. So we don't start anyone on treatment that's not got low levels. It's levels that we bring up. But before that, we've had a consultation that takes away all the red lights that we worry about, that you can do exercise, you haven't got something that's going to surprise you on some Tuesday afternoon. We try and get all the big red lights out of the way, but this is a way to keep you better for longer. That's pretty much what we're trying to do with this. And yeah, it's a happy tale, but it's a cautionary tale. And I think our reason sitting here today is to say, can it be done? Yes. Do we do it? Yes, absolutely. But don't go to anyone and just get a script and just get it repeated for 6 months.
Or at the gym.
Yeah, exactly. Don't get the trainer at the gym saying, have this injection, and not to know how much is in it. What is it going to do?
Where does it come from?
Exactly. Yeah. I mean, that was the vial that we saw was written in Russian, and no one had an idea how much was in there, what was in there. It was and I mean, I think it's actually a great time to be a 45 to 80-year-old man to have this option. But I think people just need to think clearly and have a doctor that thinks clearly about why they do it, how they do it, and how it'll change you for the better, and also have a big lookout for the side effects.
Yeah, and I think as for the girls and for the boys, we don't need to accept aging as people maybe thought about it in the past. There's ways to get that 30-year-old back into your life if it's done correctly.
And I think maybe that's where we should pause today and say, we wanted to bring the message out there that there is a way, once you've put all the little blocks, that you can actually bring the drive back, make people feel better, the regeneration, the bone health, the blood health, the positive cardiovascular effects. There is a way, but with the big caution of watch out.
Good.
Yeah, I think we'll leave it there, and it'll be nice if people listen and they leave us some comments. We've got a nice lineup for the rest of the year. So if you feel, comment either on our Facebook or on our Insta or on YouTube. So all our podcasts on Apple. And I mean, it's been quite a journey to bring some information out to
exactly. We've also posted the Ask Me Anything post on Insta and Facebook for people that want to pop in some questions there or specific topics that they want to discuss.
Nice. Thank you very much.
Awesome. Thanks, Rudy.
Okay. Cheers.
Yes. Disclaimer. This podcast is not intended as a substitute for the advice of your healthcare provider. No doctor-patient relationship has been formed through this podcast. The content here is for information purposes only.